Good morning. The experience using calcium chloride neuter injection in Ecuador. The objective, the objective of the current study was evaluate the calcium chloride dehydrate in alcohol as a method of population control in 3 impoverished rural communities of Cotacachi, Ecuador. Cotacachi is a beautiful town of about 8,000 people located in the northern Andes mountains of Ecuador. Culturally rich town, known for its leather goods and indigenous heritage. However, there is a sad truth that overshadows the community and is the dog overpopulation. About the communities chosen. On the rural area of Ecuador, you can find as a common denominator this: an overlack of education. The neuter is associated with behavior, so they will neuter the dog just for that reason, or they will be afraid to neuter the dog for the same reason. Due to the low income, the dogs are not treated as a priority. Dogs owners allow their dogs roam through the community. And this study was part of approximately 100 males presented for chemical sterilization during this campaign. Here you can see some pictures of our patients and our clients. The methodology of the injections. The dogs were given calcium chloride intratesticular injections using standard protocols. The protocols include the same kind of dog or size and the same technique. The formulation used was 20% calcium chloride and ethyl alcohol. The dosage depending of testicular width from 0.25 to 2.5 ml per testicle. The methodology of the study. Testicular measurements were taken on day 0, 3, and 30, and a questionnaire was completed by the owners on these days. The data gained from the questionnaire is subjective. The methodology of the testosterone test. We used human chorionic gonadotropin, and the test was performed on day 0 and day 30. Dogs under 20 kilograms receive 1,000 units, and dogs under 20 kilograms receive 500 units. Here you can see some locations we use to perform these clinics on the rural areas of Cotacachi. The methodology of the study. On day 0, we had 34 patients, and first we collect the blood sample, we inject the ACC&D, we put the sedation on the dog, did the measurements of the testicles, injection of calcloran. 2 hours later, we collect the second blood sample, and we send home all the dogs with anti-inflammatory medicine. On day 3, the same 34 patients were re-examined. The owners complete a questionnaire. The testicle size were remeasured, and we re-evaluate the dosage of the anti-inflammatory medicine. On day 3, injections and follow-up data were obtained of 34 dogs. On day 30, a subgroup of 16 dogs was re-evaluated. On day 30, we collect again blood samples. The injection of ACG was given IM, the measurement of the testicles taken, a second blood sample collected 2 hours later of the first injection of HCG, and then we did a small evaluation. Here you can see some of the patients of day 30. Another one. And next. Okay, so here you can see the pictures we have of our patients. This was our way to register them. So we took one picture of the faces and one picture of the testicles. About the results, I'm going to talk about first about the questionnaires we perform. On day 3, we asked if the dog had eaten well after the injection. 3% said the dog is eating less but is still eating. 97% of the people said the dog is eating normal. Has your dog's behavior changed since the injection? 9% say yes. The owners describe situations like the dog is not longer wandering or he hides and it's quiet. Has your dog been licking his testicles? 9% say yes. And this represents one part of the dogs that show swelling on the testicles. This question was important before we evaluate the anti-inflammatory medicine because we linked the licking of the dogs to pain. Did you notice the swelling on the testicles? 38% say yes. This part is subjective because some of the owners didn't check the dog. So some of them didn't realize that the dog has testicles that are swelling. On day number 30, we asked, has your dog recovered from the injection? 100% say yes. Have you noticed any change in behavior? 100% say no. Here you have another pictures of our patients. About the testicular size. Testicular size on day 3, most of the dogs show mild but significant increase swelling on the following injection. The baseline average was 23.1 millimeters, and for the day 33, the average was 29.7. This picture is of the same dog on day 0 and on day 3. The testicular size on day 30 had a significantly decrease compared with day 3 and was similar to the baseline. On day 30, the average was 22.3. And these pictures also are these pictures are also of the same dog on day 0, day 3, and day 30. Okay, next. Here you can see the average between day 0, day 3, and day 30, and you can see that on day 30 it's lower than on the baseline. During the process, the dog was completely sedated. And in this picture, we are getting ready for the injection. The owners are helping us. About the testosterone levels. Were not significantly different from the baseline to day 30. 62% was the percentage of dogs that showed an increase in testosterone levels post-ACG stimulation since baseline to day 30. Here you can see the same. On red we have the dogs that the testosterone goes low, and in black you can see when the testosterone goes up. The average on day 0 it's 1.58 and on day 30 it's 2.16. Here you can see some of patients after the injections during their recovery. The complications we had. On the 34 dogs in the study, 16 showing testicles swelling. mostly caused because the anti-inflammatory medicine is not being used. The complications ranged from moderate tissue irritation to a complete scrotal slowing. The complications are more common in dogs younger than 1.5 years. All the dogs received veterinary care and those complications were treated fully recovered. Here you can see the picture of one of the dogs that was not part of the study, but here you can see the scrotum clean because this dog scratched his testicles until make them disappear. The conclusions. After 30 days post-calcium chloride injection, there was a reduction in testicular size, but no in testosterone production. Unfortunately, due to cultural influences, our test group and follow-up size was smaller than hoped. Though dog owners indicate that there was no change in behaviors, and in order to continue the calcium chloride neuter injection, the complications must be reduced. At the end of the day, we had many happy patients and owners. Thank you so much for your attention.